Thank you, Director McCarthy and Mr. Tassi, for being here this afternoon. My name is Regina Campbell, and I'm an attorney at the Legal Aid Society of Greater Cincinnati. On behalf of the advocates I work with and the low-income people we represent, I'm here to testify against the Healthy Ohio waiver. I, along with other low-income advocates from around the state, will submit formal, comprehensive comments to the state. I will just address a few of our concerns this afternoon. In order for Ohio to create and implement Healthy Ohio, it plans to request waivers of current Medicaid requirements. In order for CMS to grant the requested waivers, the request must be for experimental, pilot, or demonstration projects to assist in promoting the objectives of the Medicaid Act. We strongly believe that the proposed 1115 waiver does not meet these legal requirements. Medicaid is uniquely designed to meet the needs of low-income individuals who have disproportionate medical needs and health challenges. It was created to provide medical assistance to covered individuals whose income and resources are insufficient to meet the costs of necessary medical services, and provide rehabilitation and other services to help such families and individuals attain or retain capacity for independence or self-care. Medicaid is designed to enhance, not limit, access to health care. Ohio's proposal, which forecasts a significant decrease in enrollment and locks all members out of coverage regardless of income level for failure to pay premiums, defeats the objectives of the Medicaid program by creating unnecessary barriers to enrollment and access to care. The proposed changes will not just affect the adults who got Medicaid under the expansion. This waiver will impose premiums on many more people who would receive what many see as the traditional Medicaid coverage. It will impose premiums on low-income parents, children aging out of foster care, women in the breast and cervical cancer program, and some who receive home and community-based waivers. It will impose monthly premiums on adults with any income, regardless of how low that income is. And if an individual does not pay those premiums, she will be disenrolled from Medicaid and not allowed back on until all outstanding premiums are paid in full. I'll echo the excellent points that Mr. Baird made. I won't repeat those, but we feel very strongly that the retroactive elimination of the retroactive coverage is not something that's legally allowed for Ohio to do. I would also say that this proposal will also affect the application process for pregnant women. Although pregnant women will not be forced to pay a premium, the waiver would change the date their Medicaid application would be approved. Instead of being approved as of the first day of the month of application, under Healthy Ohio, pregnant women would become eligible for coverage effective the first day of the month in which their eligibility is determined. That means a pregnant woman will not be covered until her county JFS processes her application. I work with overloaded, underfunded, delayed county JFS offices every day. We know they work hard, but almost every single one that we work with is processing applications well beyond 30 days at this point. And on a regular basis, we see pregnant women delaying care because their Medicaid application is delayed. Right now, any bills that they incur during the application process would be covered, and yet they still delay care because they don't understand that and they fear racking up bills that they cannot afford. So we already see pregnant women delaying care. This would simply increase under Healthy Ohio. This is not the way to create healthier pregnancies, and certainly not the way to address the infant mortality program that we all so desperately want to take care of in Ohio. Imposing these premiums on Ohio's lowest income and most vulnerable citizens makes their ability to maintain the most basic standard of living even more tenuous. A person living at 50% of the federal poverty rate, or $495 in gross monthly income, will have to pay $8.25 a month if he wants Medicaid. If he's lucky enough to live in subsidized housing, he will pay about $150 for rent and utilities. Otherwise, market rent could take up the remainder of his income. If this person has children, there will be child care premiums or school costs, as well as higher food and transportation costs. Even if this person gets food stamps or food assistance to help supplement their food costs, this will not pay off for all of their food or cover necessary items like clothing, toothpaste, or diapers. Ohio will now be asking a new group of people to decide between paying for their health care and paying for food and other necessities. In addition, there's no discussion in the waiver as to how people will actually pay these premiums and how the physical act of having to pay these premiums will impose extra burdens on low-income households. Those lucky enough to have a bank account who can set up an electronic funds transfer can easily pay their premiums and get extra incentives from the state. But many low-income people do not have or do not access traditional bank accounts. Do they travel to their county JFS to make a payment, or do they have to go to their managed care plan to make a payment? In the city of Cincinnati, it will cost an adult a minimum of $3.50 to make an in-zone round trip on Metro. Add that $3.50 onto the $8.25 premium, and the person living at 50% FPL is now paying $11.75 a month, or 2.4% of her monthly income for Medicaid. Reliable mass transportation is unavailable to most outside of major metro areas. We're lucky here in Cincinnati that someone actually could get on a Metro bus and pay $3.50. For those in more rural parts of Ohio without access to public transportation, the options to pay these premiums are even more limited. If our Medicaid recipients must mail their payment in, they will have to pay for a money order, oftentimes after they pay an ATM fee to withdraw the money from their account, or an even higher fee if they have a prepaid debit card that their employer mandates that they use. These hidden fees mean that many people will pay much more than the 2% of their income for Medicaid and will be unable to afford coverage. We feel very strongly that Healthy Ohio, as so many people have said, is not healthy for Ohio, and we will ask CMS to deny the approval. Thank you.